Ensure that you have the following for system preparation and for the procedure. 1 sheath introducer set, 1 Safari guide wire or any 0.035 inch super or extra stiff guide wire, 275 or 300 centimeters long, 1 loading tray, 1 frozen block of physiological saline, 3 liters of refrigerated physiological saline, 3 rinsing bowls, 1.5 liters of physiological saline at room temperature, 5,000 IU of heparin, 1 long clamp, 1 scalpel or scissors, 2 x 20 or 30 cc syringes with luer lock, 1 timer. To perform the exterior non-sterile inspection, first check the expiration date and then ensure that there is no damage to the box. The circulating nurse will ensure there is no damage to the pouch before opening it carefully. The sterile person will then remove the tray with the device and place it on the table. Then remove the protective foam and keep the package tray on the table. Remove the transparent cover and keep it on the table, as you will use it later as a prop for the catheter. Remove the protective tube, but don't break it. Unpack all the following components: the distal loader with the compressor, the nut, the star pusher and the loading funnel, 1 pouch with the loading tube, split ring and silicone ring, the other pouch with the safety button and the shuttle pusher, the proximal loader composed of the pushing cap, clamping sleeves and 2 half shells, the spatula, the stylet, the flush line with 3 caps, and the delivery system. Place the covers on top of each other and put the delivery system on the cover. Mind the handle position on the box so the system can rotate freely. Fill 2 syringes with at least 20 cc of heparinized saline. Assemble the distal loader. Put the silicone ring into the split ring. Place both on top of the loading funnel. Tighten the compressor until it is flush. Place the assembly in cold saline. Place the loading tube and 2 half shells in cold saline as well. Prepare the flush line. Insert the stylet. Make sure that the shuttle can move freely. Check that the insertion aid can move freely. Hold the device as seen here. Close knob 2 until you reach the hard stop. Close knob 1 until only the shuttle's nitinol cage is exposed. Open knob 1 until the outer member tip is the same length as the shuttle pusher. Open knob 2 slightly for flushing. Connect a syringe to the flush port. Flush until drops are visible from both ends. Push the shuttle in with the shuttle pusher into the outer member. Submerge the capsule in refrigerated saline. Open knob 2 slowly until the hard stop is reached. Close knob 2 until the petal flares or until it reaches the washer. This is considered the starting point. Remove the syringe and replace it with the cap. Turn the landmark ring to position A while holding knob 2 in place. Verify the valve size. Check the expiration date. Check the temperature sensors. They should be green and white. Check the valve size and expiration date again. Wearing gloves, open the bottle. The sterile person removes the valve using a long clamp. Confirm that the lot number on the tag matches the lot number on the bottle. Rinse the valve for 2 minutes in the first bowl, followed by 2 minutes in the second bowl, and a further 2 minutes in the third bowl with heparinized saline. After rinsing, cut the tag sutures using a scalpel or scissors. Place the valve in the cold saline for 10 seconds and then place it in the loading funnel, ensuring the stabilization arches are positioned upright. Push the star pusher down. Add the nut. Turn the nut until it is level with the loading funnel. Ensure the leaflets are open prior to inserting the tip of the delivery system through the loader and valve. Submerge the distal loader with the delivery system into cold saline. Turn the nut in the direction of the tiny arrows to advance the nut and the valve. Make sure that you only grip the loading funnel. Slow down and look for the hooks. Continue to advance the valve until all 3 hooks are exposed. The lower crown should remain inside the loader. Advance the distal loader to align the hooks over the stent holder. Completely close the compressor to attach the hooks. Rotate the assembly to check all 3 hooks or pins are attached by holding only the stylet and the outer member. Turn up to from A to the black dot. Open the compressor. Turn the nut 90 degrees using the arrow and marker. Close the compressor. Push the tip. Using knob 2, turn 1 notch. Repeat the steps until the 4th notch is reached and the capsule is closed. No inner member should be visible. Open the compressor. Remove the compressor and silicone with the split ring. Separate the silicone and split rings and keep the split ring on the table. Place the loading tube over the tip with the arrows pointing towards the loading funnel. Push it forward until it touches the loading funnel, pushing the split ring over the loading tube. Attach the compressor and close it completely. Turn the nut until it fully stops. Remove the compressor. Remove the distal loader while holding the loading tube in position. Remove the split ring while holding the loading tube in position. While holding the shuttle in place, advance the loading tube towards the handle until the stabilization arches are covered. Using knob 1, turn 9 notches to capture the stabilization arches with the outer member. Retract the loading tube towards the distal tip to expose the leaflets. Be sure the upper crown remains inside the tube. Using the spatula, fold the leaflets in the same direction while holding the assembly in place with your left hand. Rotate by holding the outer member to assess if all 3 leaflets are folded behind the commissural posts without protruding. Advance the loading tube towards the handle until the leaflets are covered. Turn knob 1 to completely cover the stabilization arches with the outer member, without covering the leaflets. Slide the clamping sleeve onto the delivery system. Insert the half shells into the clamping sleeve. Slide the clamping sleeve towards the tip until it stops at the loading tube. Quickly slide the clamping sleeve towards the tip, pushing the loading tube away. Remove the loading tube. Secure the clamping sleeve on the delivery system. Attach the pushing cap and turn. Stop when the stylet is touching the pushing cap. Align one shape with the window on the clamping sleeve. Turn the pushing cap until the selected shape is on top again. Using knob 1, turn 1 notch. Align one shape with the window on the clamping sleeve. Using knob 1, turn 1 notch. Continue with this cycle until the proximal edge of the upper crown reaches the distal ring of the outer member. Remove the proximal loader. Disassemble and remove the distal loader. verify that the stabilization arches are separated or are not entangled. The upper crown is fully covered and in contact with the distal rings. All hooks and pins are attached. The capsule is closed. Connect the flush line to the flush port. Remove air from the system using the syringe until no air is visible. Remember to leave the flush line open to allow any further undetected bubbles to escape during the insertion of the delivery system into the patient. Remove the syringe from the flush line and attach it to the guide wire port. Advance the insertion aid towards the distal tip until resistance is felt at the level of the upper crown. Remove the stylet. Flush the guide wire lumen until no air bubbles appear in the tray. Remove the syringe. When the physicians are ready for the valve, apply pretension by turning knob 2 in the opposite direction of the big arrows until the hard stop. Insert the safety button.